Hello, I'm Robert, and this is about people who are asking how long should you quarantine if your COVID can't contact? Because there's so many different days going around. And the UK now says 10 days, it used to say 14 days, the WHO say 14 days, Bhutan say 21 days. So why are all these different numbers? This is about if you are a contact of someone who has COVID-19. Or if you don't know if you've been a contact, but you just want to quarantine, say before meeting up for Christmas with other people. And so the background here is that you have the virus. If you've been infected, the virus is in your body for a long time, much longer than for most diseases, before you start to show symptoms. With flu, then the virus will be in you for just 1 to 4 days before you get symptoms. And it's usually only 2 days later that you get symptoms. You're infectious the day before you get symptoms. So this means that if you get infected with flu, then you're infectious almost immediately. And this is why contact tracing doesn't work for flu. With SARS, it was 2 to 7 days, so they could do contact tracing with SARS. And with MERS, it was 3 to 5 days. And with COVID, it's 2 to 14 days. And that's so much longer, and that's why contact tracing is so very effective for COVID. And that's how New Zealand was able to get like that, through doing contact tracing. And that's why it's so sad that the United Kingdom is really not put its heart into contact tracing at all. But you privately could do contact tracing. If you are the contact of someone, you should quarantine and isolate, even if nobody's rang you up to tell you, if you know that they had COVID. So that means that if you get COVID from someone else, then it could be anywhere between 2 days and 2 weeks before you have symptoms. And it's only 2 days before that they can actually detect the virus in your body. So say I got infected today, then it might be 12 days from now before it's even possible to detect the virus, even if it was detected every day, even if they tested me every day. So you could be negative for 12 days and then test positive. Most people half of people take at least 5 days. So it'd be negative, and then positive if you tested every day. And all that time the virus is in your body, but it couldn't be detected. So that's the incubation period. So why do we have all these different numbers for the length of it? Well, the reason is that it's really a trading off between the risk of still having COVID at the end and the inconvenience of how long you wait, how long you spend in quarantine. Because it could be, so as I said, Bhutan has 21 days, and this is what they call logarithmic, that this is a tenth of a chance, and then this is 100th of a chance that they last that long. So everyone has incubation at least 1 day, and then a tenth of them will still have incubation, about 8 or 9 days later. 100th will still have them 14 days later, and then if you get to 21 days, it's more likely it's less than 1,000th. We'll still have it after that. And so, but this is, it's very, very difficult to do the research. You can't infect someone and then just wait and see. It'd be very easy to do if you could just infect people deliberately and then wait to see how long it took before they develop symptoms. But we can't do that. So you have to try and guess when someone was infected. And sometimes it's pretty clear and sometimes it's not so clear. So this was a rather more thorough, this was a study with many more people, and it looked like a pretty good one, because this was back when the virus was only in Wuhan, and there was hardly anyone outside there. And then people started leaving Wuhan and taking it to the rest of the world. So that's way back in January. And so then they looked at how long it took between people leaving Wuhan and first showing symptoms in some other country, like say Canada, United States, Vietnam, or wherever it was. How long did it take between leaving Wuhan and developing symptoms? And this shows that for some people it took over 20 days, 21 days, one person took 23 days before they showed symptoms. And if you look at the 14 days, then you can see that most people did develop symptoms within 14 days of leaving Wuhan. Now, there was a possibility that they very likely got infected some days before they left Wuhan, rather than on the actual day that they left. So then you get this theoretical curve, which is the actual incubation period, if you allow for that, by doing a bit of clever maths. And as you can see, that suggests there still is quite a chance beyond 14 days. And this one came up with for 10%, it's more than 2 weeks with this study. But it might have been skewed if there were people who got infected outside of China. Then that could have made it last a little bit longer that way. And that's what makes it so difficult. Now, we do have some actual examples but again, they're controversial. So this one made it 1 in 100 appear after 14 days. This makes it 1 in 10, so that's quite a big difference between those two studies. So now if we go and look down again, where did I put it? New Zealand. Have I gone and lost it? Never mind. Let's see. Oh, here we are. Here's New Zealand. Yes. So there was a case of a man in New Zealand who developed symptoms a week after completing a 2-week quarantine, because this was when New Zealand had got rid of all its cases internally, and then they had a 2-week quarantine for people returning to New Zealand, and this was New Zealand who was returning. He was in quarantine. He returned from India. He was in quarantine for 2 weeks, and then a week later he developed symptoms, and he had already given it to his wife and child, and by the time he was isolating. So this shows that, and he may be this very 1 in 100, he may be this 1 in 1,000 chance. If you go up to this figure, then that's 1 in 1,000. Yes, so I didn't explain this figure properly. So that's the 99th percentile with this very early study, with less than 200 people, but it's still cited by CDC and WHO. It seems to be regarded as being quite a good one. So you see, with the 99th percentile means that based on the data they had, the rather limited data they had, but quite good, because it's very early on, before there were many cases of COVID-19. It's much more confusing nowadays. Then there was a 1 chance in 100 that actually the number who lasts more than 14 days is way up here. And this is logarithmic scale, I'm not sure what it would be, maybe a 20th or something. And there was also a 1 in 100 chance that nobody even gets as far as 14 days. So that's what those percentiles mean. It could be this curve. There's 1 in 100 chances like that, 1 in 100 chances like that, which would mean a very long quarantine, isolation, incubation period. Incubation is the time, it's like incubating an egg. And a hen sitting on an egg, it's the time from when it sits on the egg to when the duckling or the chick hatches. That's the incubation period for an egg. In the same way, the incubation period is how long our body is sort of incubating, like the hen on the egg, incubating the virus before it starts to show symptoms. It can be 2 weeks. Well, it might be that it can be 2 weeks. So this New Zealander, then that could be 3 weeks, and that seems quite a strong example. And then there was another case in Hubei province quite early on, the 22nd of February, seemed to be an incubation of 27 days, another could be 19 days. But the World Health Organization cautioned that these long incubation periods could be because of someone being reinfected by someone else, being infected by someone else. So they were in contact with a COVID-19 patient, but they didn't get infected, and then 2 weeks, 3 weeks later they got another infection. So that's what makes it so complicated. That's why it's so very hard to find out and to know for sure. But the New Zealand was quite a good case because there was no COVID in New Zealand at the time, so whether he could have got it from someone while he was travelling inside New Zealand. So that seems a little bit unlikely. So it does seem there's quite a lot of evidence adding up to the likelihood that maybe, even if it's only just 1 person in 1,000, 100, 1 person in 1,000, or what the number is, but it seems there's a small chance that you could have it even more than 2 weeks after you're first infected. And but that's not proven. It's not known. It might even be that nobody is infectious after some much shorter period, like say 12 days or something. And so I keep looked up. I try to find the latest research, and there just doesn't seem to be anything. Nearly the WHO and the CDC, as I say, they cite this study, which is an awful lot of uncertainty, and there doesn't seem to be anybody saying that they've now decided exactly how long the quarantine period is. And there's a paper in The Lancet, which a very recent paper, just a few days ago, which is setting out, trying to advise people how to do these studies for the future, which again suggests it's not settled. And they're still working out how to find out the answer to this question. So what does this mean for our decisions about how to quarantine? Well, different governments just make different decisions. The World Health Organization has decided that 14 days is a good point, but the United Kingdom decided 10 days. Now, if you want to, if your aim is to reduce the transmission as much as possible, then it really doesn't make much difference if it's 1 in 10 or 1 in 100. The main thing is to test and isolate lots and lots of people, and then they all quarantine, and then, even if it's 1 in 10, you've reduced it by a tenth. You've reduced it 9/10 the number of. So if you could have had 10 contacts, that would have. If you had, say, 10 people amongst all the contacts of quite a few people, if you had 10 of them was going to go on and infect someone, then if you can reduce it tenfold, you get down to 1. So in terms of the effectiveness of testing, tracing, isolating, then it really doesn't make much difference if you choose, say, 14 days or, say, 12 days, say, or even 10 days. It's not going to make an absolutely huge difference. Unless you're in a situation like in New Zealand, where you've got it way, way down, and you're trying to stop it completely. And then in that case, then, especially if you quarantine people coming into your country, then if you have it only 10 days, then you would think, well, we've really left it with quite a high possibility that out of 100 people, say, a few are going to get through. And if you were like Bhutan, then they have been very strict about trying to keep it out. So they have 21 days. So then they have a very, very low chance that anyone gets through the quarantine. So those are the sort of things you've got to make these decisions. Now, when it comes to individuals isolating and quarantining, well, and basically as long as you can do it, the better, really. If you're talking about you want to quarantine and you're thinking in terms of your granny or your grandpa or something, and you want to protect them, then more than 10 days would seem like a good plan. And so you just think, is it 12 days, 13 days, 14 days, 15 days, so on. The longer it is, then the more you're reducing the risk. But if you know you're in contact with someone, then and really, the safest thing is It would be to have it like 21 days, like Bhutan or something like that. So, but that is if you know your contact with someone. If you're waiting for meeting people over Christmas, say, and you think you already got a very low risk of actually being in contact with anyone, you haven't been told that you're a contact, and you've been keeping. If you've been doing the physical distancing, like in my case, I've been doing the physical distancing very carefully, and I'm very confident that I'm very safe from COVID-19. Just like Bruce Aylward said after he came back from China, and he said, I'm very, very safe. I'm probably he was probably the lowest risk person in the room when he was there talking to journalists because he was so careful. So if you're very careful, then you can say, I'm practically zero risk really, and then basically you've been doing the same thing as quarantining. You just haven't had the contacts anyway because you've kept the physical distancing. You've not touched your eyes, nose and mouth when you're out and about. You've washed your, or at least tried to minimise that. You wash your hands when you get back. You wash your hands before touching your face for a long time. You if you've got surfaces, you wash those as well, and wash with soap. With this device, just explodes with soap. So if you've done that, then effectively you're the same as quarantining, even if you're out and about and talking to people and step back whenever you talk to them. Then you're isolating probably better than some people who are quarantining in their own household and maybe not keeping away from other people in their own household. So and then if in terms of your own household, really, if you are at home, if you discover that you are a contact, then the main purpose in quarantining is to protect your own household. The highest risk of transmission is to your own household. And unlike the case with flu, if you were told, you've been in contact with someone who had flu yesterday or the day before, there'd be almost no point in quarantining, in trying to isolate away from your own household. You've almost certainly given it to them already. But if you are told that you are a contact of someone who has COVID-19, then it's almost certain you haven't given it to your household. Even with people who go on to develop COVID-19, even if you've got symptoms, and you're told to isolate because you've got symptoms, it's almost certain you haven't given it to even to your spouse or partner. It's quite unlike flu. Indeed, 1 in 5 don't get it from their partner. So that's very, very different from flu. Don't get it ever. So, but then the 1 in 5 who does get it may be the super spreader. And it's not just them. It can easily be that the entire family gets it. It tends to spread like that. So it's out of 10 people, 8 won't give it to anyone in their own household. They're surrounded by people, they just don't give it to any of them. Then 2 people will give it to maybe 8, 10, 12, 20 people in some big family event or something. And it's not so much super spreading people as super spreading events. So basically, the main point in quarantine is to isolate away from the rest of your household before the super spreading event, whatever it is, happens. So that's the main point in isolating and quarantining. The super spreading event could be anything, It's basically, it's like an event where you're face to face and quite close together, and but that can happen and there's no super spreading. So it's really quite mysterious why some people get infected and other people don't, and why some people who get infected develop the sickness and some people are asymptomatic. And there's no lot of science, still just because you've got the same problem, that you can't do the experiment. You can't just take someone has got COVID-19 and say, well, go and have a party with these other people. And then you never actually, so when you find someone is infected, especially with a very long incubation period, then you very likely don't know which was the actual super spreading event, except in some very clear situations where they only met during that period. and then afterwards, so like the choir, like a choir, for instance, choir practice one a week, and after the choir practice people started getting sick. In that situation, and there was one case in that choir, in that situation it's very clear that the choir caused the super spreading. Even then, you know that as in aggregate. We don't know that maybe for certain for each individual person who's at the choir, especially if they'd had contact with someone else who was in it, or with someone else outside who'd had the disease. So it's really quite difficult to find very clear answers on this, but they're gradually finding out more. Anyway, so personally, I think what our government should do, our government has been, in the United Kingdom, has been responded to this by fining people £1,000 if they don't isolate. And that's a very big incentive for someone who's not got to pay high amount of, has got a lot of money, you know. I mean, for most people in the United Kingdom, £1,000 is a lot to lose in a fine, and so it's a big incentive to just not get tested, because if you're not tested, you don't have to isolate. So it's been really a rather perverse incentive to people not to get tested, and then not to isolate, not to let on who their contacts are, so they don't put their contacts in this awkward position. But it's really the opposite of what they should be doing. What they should be doing is making isolating and quarantining, incentivizing people to do that. Instead of fining you for not doing it, they should be incentivizing you and saying, you know, this is a thing to do, and so they should be supporting us, supporting you financially. If you isolate and quarantine, they do a little bit of that. £100 for people with being tested, £100 thing. You know, for people who go on very low income, for if you need to quarantine or isolate, and one-off payment. And they don't actually go around and help people who, for instance, in a multi-generational family or just lots of people in small space, it's quite difficult to isolate away from other people. I strongly recommend that if you are in a situation where you need to quarantine, I would say have a look at the WHO guidance on how you should quarantine. And this is the guidance for people who don't even have separate rooms. So that even in that situation, then you can make sure your beds are at least a metre apart, and you always you're a large elevated single room, good hygiene, and so on. And then if you have to actually isolate because you've got COVID-19, it's very much stricter. Then you and the patient should both wear masks, and you should have stay in a separate room, ideally a separate bathroom. So what was that for? Suspected or confirmed COVID-19. And you don't share your eating utensils, dishes, drinks, and towels. You don't share that. You wash your hands regularly. You both wear masks when you're next to each other, and you monitor each other's health and so on. And be ready to call if you have any difficulty breathing. Call your healthcare facility immediately. So many people try to home treat lack of oxygen. You can't. There's no way. Even if you buy oxygen bottles, they're surely not rated to be able to do that. No, if someone has trouble breathing, immediately tell the doctor. Ring up the emergency. Ring up the quick access helplines. And yeah, so that's all that. And this is an example from way back in Wuhan. I'll turn the sound off. There we are. So this was, they were using, it was pretty much the same thing, both wearing masks, and they do too much. So this was the husband and his wife, and it shows how he was looking after her, and he actually wore a full bodysuit. And the WHO don't say you need to do that. It's okay to just both wear masks, because it's the droplet transmission is the main thing. but it's a clinical mask. You replace the mask every day, and you stay 1 meter away if you possibly can, even when you're in the same room. Wash your hands when you go out, and then if you do have to be closer than 1 meter, that's why you're wearing the mask. And so there's hardly anyone in the United Kingdom is doing this level of isolation, and as a result they're giving COVID-19, the 2 people out of 10 that I talked about will be giving COVID-19 in a super spreader event in their household. So it's no wonder that it spreads, still spreading largely in households. Most of the super spreader events aren't the big ones in public, they're ones in a household where you get a party and then everyone, all the family and extended family, they all get COVID-19. And that's in case you have 10 parties, with 8 of them nothing happens, with 2 of them then everyone gets COVID-19. It works more like that than the way you expect with the flu. It's a very different kind of disease. We're just not used to it, we don't have it, this idea of how to deal with it. So anyway, I'd better stop that soon. I think I've said everything. Anything I need to say about? So, and basically just, it's how long is a piece of string. If you're wondering how long to quarantine, just quarantine as long as you can. And if you start off with, if you're going off to see your granny over Christmas, and if you start off with it's actually very unlikely that you actually had a contact with anyone, you've been quite careful, you've kept a distance and so on, then the shorter quarantine period, then you've still got, it's still reducing your price, your chance usually, or even 7 days, then that will be 1/10 of the risk that you had originally. And then 14 days, or 7 days could be, it depends which curve you're on, it'll halve it anyway, this logarithmic curve. 10 days would be 1/10, something like that. 14 days would be 100th, if we go by the mean path there, mean one there. And longer than 14 days, reduce it even further. This seems probably the best one to actually go by, given that we don't have a definitive answer. So that gives you an idea. So something like if you are staying for 10 days, you reduce your probably originally very low risk if you're being careful by a further 1/10. If you can isolate for 14 days, you reduce it by 100, and so on. And if you can isolate for another 3 weeks, it seems to be another 10-fold reduction for every week roughly. So it'd be about another 1,000 for 3 weeks. Whereas 10 days, not quite. 10 days it's 1/10. 14 days it's about 100th, and if you just go by this curve, and 3 weeks it's 1,000th. And so it's if you had 1,000 people, then maybe one would still be who all were infected. Then maybe one would still have it after 21 days. We don't really know in those numbers. So anyway, hope this helps some of you to have a better idea of the picture here and to understand. And it's just it's the different governments, different countries, they come up with these figures because they've got a different situation, they've got a different amount of spread in their country, they've got people in the country who have different habits, and in some cases the people might have more time, might be more readily able to quarantine for a while. If you quarantine people coming into your country, then it's a very different situation, because you've got fewer people you've got to deal with. If you've got hardly anyone in your country, if you've got nobody in your country with cases, you've got to be especially careful with your quarantine period. I can't see New Zealand reducing their quarantine period of 14 days. So, because they've got to be super careful. So anyway, hope that helps some of you.